नमस्कार। यहाँ पे बैठे सभी अतिथियों का स्वागत है और मेरी तरफ से नमस्कार। मेरा नाम प्रीतम कुमावत है और मैं को फाउंडर हूँ संस्कृत स्मार्ट सॉल्यूशंस प्राइवेट लिमिटेड का। और आज यहाँ पे हम बात करेंगे हेल्थ केयर इकोसिस्टम के बारे में, जो हम एक सॉल्यूशन लेके आए हैं विच कैन एक्चुअली सपोर्ट where we require support from the temple ecosystem and to make sure that we take healthcare to the last mile. And that's the mission what we have. Before that, I would like to say thanks to Mr. Girish Kulkarni, who is the founder of Temple Connect, and Mr. Prasad Lad, who is the chairman of ITCX. Let's give a big round of applause for them first. Because I'm sure this is one of the best platform where we can convey our message and where we can gain the knowledge, because since yesterday I have been watching a lot of presentations by temple authorities, and it's an eye-opener basically. So today also we'll talk about something related to health, which is Anna Vastra Nivara, or most important now, Swasthya. So before that, I'll show you one quick animated video which can give you an idea about what we are going to talk about in the next 15 minutes.
The current situation has challenged the healthcare system in India in many ways. How will we tackle such outbreaks in the days ahead? Let's understand it precisely. We are currently tackling some serious concerns. In India, access to basic healthcare facilities such as doctors, pathology labs is difficult for the majority of the population, and especially when the remote regions with limited health services experience a pandemic like COVID-19. An early diagnosis leads to correct treatment. Swayam, a Make in India innovation, can help bridge the gap. Basically, doctors need a lab report to form a correct diagnosis. Portable diagnostic equipment that functions outside the hospital is the perfect answer. Swayam, Anytime Healthcare Monitoring System is your ultimate solution to conduct mass tests and screenings with minimal human intervention. It's a fully automated service kiosk that takes the user from test to doctor and from prescription to medical support. A Swayam kiosk is easy to set up and can be installed in any premises. Swayam comes up with unique features, over 60 health tests integrated, instant health reports or prescriptions, video consultation with doctors, access to health records anytime, anywhere. Each user or patient's data can be filled, updated, monitored and reported anytime, anywhere. The real-time data analytics and centralized health data can help the government and other health organizations to form the right policies and take corrective actions. Apart from being the most advanced healthcare solution, Swayam comes with more features. It can make communication effective and can also generate employment opportunities. Swayam is the future of healthcare sector. बढ़ाओ कदम अब स्वस्थ भारत की ओर, स्वयं कर लो जांच, पाओ बेहतर इलाज.
Thank you very much for watching the video. As you have seen in the video, in recent time, not only in recent time, since what India is very advanced country, and now we have best of technologies, best of doctors in India. People are coming from the world to get the treatment done in India. But what we are lagging is an easy access for basic healthcare. We can see a lot of research happening in cancer, like in many diseases. But what if we can create a platform where people can go and do the screening at initial stage and get it diagnosed so that they can prevent themselves to get at severe stage or maybe hospitalization. And that is the mission what we have started since last 6 years. And the name of the product is Swayam. So what means Swayam? So our company name is Sanskrit Tech. Sanskriti Tech, basically it's a Sanskruti and technology fusion, and Swayam is the product of the company. So Swayam means on your own. So we are on that mission of taking that healthcare to the last mile, where people can, we can create an easy access for basic healthcare at affordable cost. So I'll just take you to some technical parts of it, so that you get an idea how we can, initiate this with the temple ecosystem also. As I mentioned, there are many challenges in healthcare deliveries. A lot of organizations, government, they are trying their best to make it available for the last mile of people. But there are a lot of challenges, like lack of affordable healthcare services, not having that easy access with the technology or healthcare infrastructure. So how we can create the solution? So this is what the Swayam is all about, where we have launched a system which is not only doing the diagnostic test, but it has also smart telemedicine, and also very important, which is a data analytics system for the administration and the government, where they can analyze the entire population, what kind of a disease, they can maintain disease registry, we can have a gender-based database where they can, which can help them to form right kind of a policies and strategies. So the machine which you are seeing on the screen, it is a very portable machine which looks like a bank's ATM. So many people term it as a health ATM also. So how the banking industry got transformed in last 25 years with the kind of ATM. So they basically created an easy access for the financial transaction. And this is what we are trying to do with the healthcare. So the machine is already integrated with more than 100 test parameter with the clinical grade standards. And this is India's only system which is approved by CDSCO, Ministry of Health. We can do the same video consultation with the same system. There are a lot of data analytics can happen. It has also many cardiac parameters, many important test parameters which can be done instantly. Now, what I mean by instantly, we can get the reports as soon as you perform the test, you get the reports instantly as good as your conventional lab test. So basically it is to empower the existing healthcare infrastructure where doctor can form their opinion on the basis of diagnostic reports which they get. How it works, basically a patient can just walk in, do the basic registration, get the health checkup done, and get the reports on WhatsApp, and we have multiple methods of output for the reports. And as soon as you get the report, if you feel you need to connect with the doctor, we can connect with the doctor who are on panel, or we can outsource it to other agencies also who are there in the industry. Now, it is again very easy to operate. Any person with the basic paramedic training can operate this machine, because we understand the challenges of human resource in the tier 2, tier 3 and rural. So it is very difficult to get trained lab technicians, phlebotomists. So it's, however good technology is, it is not going to be useful unless people are able to use it very easily. So we have tried to make it very user-friendly, where people can use it very easily around the clock. So it has also inbuilt telemedicine, which I explained. And so our idea is not just to give the diagnosis report or a telemedicine. We have also inbuilt online telemedicine platform where we can integrate with the many Jana Aushadhi Kendra also, wherever we want to establish these kind of centers. So it can, where we can integrate with the generic medicines and OTC products. So from diagnosis to telemedicine, and from telemedicines to prescription fulfillment. That is how we are trying to create the, complete the circle, which can lead to therapy. So this, what you are seeing on the screen is a data analytics dashboard. Basically, it helps to for administration and the government or maybe temple organization, where they can monitor whatever is happening at the place of the kiosk or these kind of installations on a real-time basis. We also have additional screen on the machine which can actually use for the communication. We can run even some social messages or awareness messages. And also we can, in case of any, we can even monetize that space. We have also smart mobile apps which connects with the, as soon as you register, you are part of that ecosystem and you can access your health history. Doctors can give telemedicine services from the mobile app itself. Now, how we can integrate with the temple ecosystem? Now, since yesterday, I have been hearing a lot of good presentations, and really those were eye-opener. And many temples are doing a lot of healthcare activities. Now it's time to even take that with the digital help. Now only building hospitals will not make enough. We need to create that hub and spoke model where we can bring people to the hospital. We need to create small centers, and this is an ideal solution for these kind of centers where we can provide healthcare services to the villages, to the camp, to the foundations, and connect them with the existing big hospitals. So we can also create the hub and spoke model with this solution. These are a few news which you have been seeing, and I'm sure you are aware of all these. Many temples are joining hands with to promote the healthcare for the needy people. So we have also converted this into a big van, which is India's first complete, most advanced mobile primary healthcare on wheels. So it has integrated with the complete lab on wheels, telemedicine, it has ECG, X-ray, and you name it, and we have it. So this is a complete diagnostic van where we can take and we can give the solution in the villages. We don't have to take the samples back to the laboratory. Which can cost us as a logistic, as well as the time is a big issue with that. Also, we have a portable solution which can be held for the medical checkup camps, where a lot of NGOs and trusts are organizing camps in the rural places. So this can also help. There's a few galleries. So we are working with a lot of government organizations, including in Uttar Pradesh, Maharashtra, Goa, Gujarat, Karnataka. And since yesterday, I have been meeting a lot of people, and a lot of people have shown interest. So we are demonstrating the machine in the expo, and you can visit whenever you are free, or you can come to the just next to the food stall. So before I close, I would like to show a real case study which we are doing in Uttarakhand, and it's a 7-minute video. And meanwhile, if you have any questions, please feel free to come at the stall, and we'll be happy to explain you all. Yeah.
मेडिकल और एजुकेशन के चक्कर से लोग शहर की तरफ पलायन कर रहे हैं ना, क्योंकि अब कोई बीमार हो गया, यहाँ सीरियस बीमार होते हैं, अब कुछ होने वाला नहीं है, समझो वो मर ही जाएगा।
यहाँ खाली कंप्यूटर रहता, डॉक्टर भी नहीं रहता यहाँ।
बहुत दिक्कत होता है कि रात को बीमार हुआ तो
दिक्कतें तो बहुत आती है पहले, क्योंकि स्वास्थ्य यहाँ पे दूर दराज एरिया है, डिस्ट्रिक्ट हेडक्वार्टर से कम 75-80 किलोमीटर दूर है, और पास में एक हॉस्पिटल है, वहाँ पे डॉक्टर भी रहता नहीं है।
अब यहाँ से होता है अमीर जाए, गरीब तो जा भी नहीं पाएगा। कभी बहुत इमरजेंसी होगा, भी तो रोड ब्लॉक होगा तो कैसे जाएगा।
अचानक से कोई इमरजेंसी हो जाए तो दिक्कतें बहुत आती है, फिर यहाँ से रातों रात गाड़ी करके उत्तरकाशी ले जाना पड़ता है।
उत्तरकाशी से हमको कहीं ज़्यादा हुआ तो फिर नीचे जाना पड़ता है देहरादून की तरफ।
इधर तो 7 गाँव है हम इधर तकरोर में, तब तो बहुत बढ़िया, अच्छा अस्पताल खुला तो बढ़िया है।
पैथोलॉजी में जो टेस्ट हैं, अगर वो जब तक क्लियरिफाई नहीं है या उनका ढंग से आइडेंटिफिकेशन नहीं कर पाए डॉक्टर, तो उस हिसाब से आपको प्रिस्क्राइब भी नहीं कर पाएंगे।
यहाँ पेशेंट बहुत दूर दूर से आते हैं, जैसे माना ऊपर से जैसे जखारी गांव है, यहाँ सड़क नहीं है, 5-7 किलोमीटर ऊपर है। तो जो पेशेंट आ गया, माना यहाँ कोई पेट दर्द का है, कोई कैसा है, तो यहाँ पर बेसिक की जांच होती है, जैसे हीमोग्लोबिन है, HIV है, जैसे जो एकदम तुरंत किया और हो गया। तो बड़ी बड़ी जांचें यहाँ पर नहीं होती थी आज तक।
So the problem we realize or we observe that despite of in India we have best of doctors, best of technologies available here in India, but still the access to the basic healthcare is still not available to the majority of Indians. And if you see the rural part, you don't have any, there is a problem with the infrastructure, there's a shortage of manpower or trained doctors. We have seen places like where you don't even have a basic, the healthcare facilities. After the observation and after the discussion with the technical team and the clinical team, we decided to come up with such solution which can be transported from one place to another place very easily, which can be installed very easily, and which can be operated also very easily with the lowest manpower or lowest any clinical requirements or lowest capital expenditure also. You can actually port it from one place to another and install it very quickly and provide that easy access for basic healthcare, which is a missing link across India. They are actually starving to get some kind of facilities where they can actually communicate with the doctor or they can get the early diagnosis.
When we are talking about universal healthcare coverage, diagnostic gap remains the biggest setback in primary healthcare. If we are able to narrow this diagnostic gap in common conditions like type 2 diabetes mellitus, high blood pressure, tuberculosis and malaria, we'll be able to prevent millions of premature deaths every year. So on this platform, we can cover almost 80 to 90% of the commonly screened tests which doctors need for timely diagnosis and treatment.
Currently in SWAYAM, we have integrated more than 80 test parameters, including invasive and non-invasive. In invasive tests, we have cardiac markers, hormone markers, blood-borne disease, respiratory disease, metabolic disease, and vector-borne disease. We also have telemedicine platform through which patient can do video consultations with doctor anytime, anywhere.
इस मशीन से मुझे लग रहा कि इसमें काफ़ी फ़ायदा मिलेगा लोगों को, पब्लिक को, जनता को। जो गरीब जनता आती है दूर दूर से, बहुत दूर से जो माना जनता आई और उसको माना यहाँ पर स्वास्थ्य लाभ मिलेगा तो उसको बढ़िया लगेगा।
लोगों को देर दूर नहीं जाना पड़ेगा, खर्चा वर्चा बचेगा। फिर ऐसा देखो, ऐसा आजकल बरसात है, बरसात आप जानते कितना रोड ब्लॉक होता है, पत्थरें गिरता है सड़कों के ऊपर से। तो जब यहीं हो जाएगा तो लोग क्यों जाएगा, है ना। वो जो आपका जो स्कीम अगर आप यहाँ वो लगाना चाहते हैं तो वो तो बहुत अच्छा है।
किसी को हाल बुखार भी हो जाता है, लोग रात को भी डर लगे ना, डर से लगेगा। गांव में ये मशीन आ जाए तो बहुत अच्छा होगा।
एक तो पेशेंट का समय बचेगा और इलाज भी टाइम से हो जाएगा। इमरजेंसी केस में तो बहुत ज़रूरी है ये कि मतलब जल्दी से जल्दी ट्रीटमेंट मिले, नहीं तो बहुत दिक्कत हो जाती है।
हाँ, अब ये जांच का रिपोर्ट है, हम लोग इसको ले जाके कहीं दवाई खा सकता है।
तो गरीब जनता के लिए जो स्वयं आप लेकर आए हैं ये बहुत ही कारगर साबित होगा मेरे हिसाब से।
पहाड़ों में दिक्कतें ऐसी चलती ही रहती हैं, तो अगर इस तरीके की मशीन अगर हर छोटे सेटअप पे हो और छोटे ब्लॉक्स में हो, इस तरीके की हो, तो बेसिक टेस्ट या बहुत सारी चीज़ें जो है हम स्वस्थ भारत की तरफ जो है बहुत अच्छे से बढ़ सकते हैं।
The data which is generated from these villages can actually help district collector or chief medical officer to take the right actions, not only in situations like this COVID pandemic, but on a regular basis. That's how it can help the citizens as well as the government. And we are trying to bridge that gap and create a sustainable, affordable solution, which will be a win-win situation for all of us.
So thank you very much everyone for watching, and thank you organizers for giving me this opportunity. Thank you everyone. Kindly visit our stall. Thank you. Thank you. Thank you. Yeah, sure.
थैंक यू सो मच प्रीतम जी। मैं रिक्वेस्ट करूंगी श्री अमित अंबेडकर जी टू प्लीज कम अप ऑन स्टेज एंड फेलिसिटेट प्रीतम जी। दोस्तों जोरदार तालियां हो जाए। I would request you to please come and during the